Today we're jumping into a topic that might surprise you, that just brushing your teeth won't save them. Let's dive into it. In case you don't know me, I am a general dentist, board certified, been doing this over 12 years, and I'm here to tell you that just brushing your teeth won't always necessarily save them or prevent you from having dental issues or cavities. And we see this all the time, right? On social media, different ads that we're seeing on television of people promoting products for brushing your teeth, and you kind of assume that just by brushing your teeth, you're just gonna have no problems at all. Use this toothpaste, use this toothbrush, and just simply brushing your teeth is gonna make all your problems go away and keep you away from that dental office so you don't have to go in there. You don't even have to worry about going to the dentist because you're just gonna brush your teeth and you're gonna fix those problems. I'm here to tell you that is not true, and here's why. Now, brushing your teeth is critical, but that is only one part of the puzzle. The other parts that are actually really important are how do you brush, how much time you spend brushing, are you brushing the right way, are you flossing, what is your diet, what are you putting into your mouth, changing the pH of your mouth, and also what is your home care routine. Now, your diet plays a critical role in your rate of cavities, and just by brushing alone isn't gonna have any effect because some of that stuff can actually erode your enamel. You'll probably be shocked to know how much sugar is actually in these sugary drinks. Those energy drinks that you drink every morning, how much sugar is actually in those? How much sugar is in your coffee? When you have coffee and you're adding creamer, that is a ton of sugar that you're putting and changing the pH of your mouth. So brushing your teeth isn't gonna be enough if you're fighting that against something like sugary diet, really poor diet, stuff like that. Probably one of the worst things you can do for your mouth is actually eat sugar gum. Now, sugar gum is actually bad for two reasons. One is it's got sugar in it. Two is that you're mashing it in between your teeth. It's already hard for your toothbrush to get into in the first place, over and over and over. And so not only is it causing cavities, but it's actually jamming those cavity causing things, which is the sugar, in between your teeth. And that is making it very difficult for your toothbrush alone to actually be doing anything. So I always recommend xylitol gum. Now, xylitol gum has a special ingredient in it that can actually make your sugar, it can actually trick the bacteria in your mouth to eating that, and the byproduct is not a cavity, it is just a byproduct that you just rinse away with your saliva. So xylitol gum is very, very easy thing to say. It's actually very hard to spell. It's like Xylitol, xylitol. You can order it online. Now, if you go to the gum section of the grocery store, you're not gonna find a lot of this because it doesn't have the notoriety of sugar gum, doesn't have all the advertising, it's not as popular. People don't want the popular things, they want the sugar gum, they want the minty gum, they want the stuff that actually tastes good, that looks good, it's got all the marketing behind it. But xylitol gum, you kind of have to look for it. It might be a little bit more expensive too than the brand name gum, but the xylitol gum or any gum that has xylitol on it is gonna be sugar-free. It's gonna be way better for your teeth. And I'm guaranteed you're gonna get some eye rolls here with the flossing, but you need to floss your teeth, and here's why. I didn't know this, nobody told me this until I was in dental school. I was 24, 25 years old when somebody told me this, that flossing your teeth actually eliminates most of where the cavities are. 90% of cavities come from in between the teeth. And if you're not flossing, your toothbrush is not getting in there. When you think about your toothbrush, it does a really good job of brushing on the top, the sides, and the insides. That's only 3 surfaces. There's 5 surfaces of the teeth, and 90% of the cavities just kind of get swept up in this little area right below the contact where your 2 teeth are touching. That is the interproximal area, and most of the cavities are right in between the teeth. We can't see those, you can't see those, you can't feel them, and they go undetected all the time because your toothbrush just simply isn't enough to actually get in there. Your toothbrush does a really bad job of getting in between the teeth, whereas flossing will. So don't roll your eyes at me. I see you rolling your eyes about the flossing, but once every single day is all you need to do to floss. There's a certain way you need to floss, and I cover that in other videos. So if brushing alone on your teeth isn't enough to actually stop cavities and actually give you good oral health, going to the dentist is also something you need to do. You need to go to the dentist regularly. We can solve problems before they become problems. Prevention is always the biggest key in dentistry, and most people don't understand that. They just think that we're looking for things to fix. They think we're looking for ways to make more money. Hey, you have this problem. Hey, you have this. People get tired of us pointing out problems. We don't really care if you fix them. We're just there to tell you you have problems, and here's what will happen if you don't do them. It's up to you to take care of your teeth, not me. So I'm just here to tell you what the issues are. So if you're thinking to yourself, I'm not gonna go to the dentist because I'm not gonna let them tell me I have problems, that's pretty naive because you probably have a problem that's brewing and brewing and brewing, and just because it doesn't hurt does not mean that there's not a problem. So if you're brushing your teeth and not going to the dentist, there are things and ways that we can do to actually lower your cavity rate. Every dentist wants you to have less cavities and less dental problems, but if you don't go, we can't help you with that. Also, when we talk about brushing your teeth, most people are brushing their teeth wrong. They do not know how to brush their teeth. So really quickly, I won't bore you with this. I'm gonna show you how to brush your teeth the right way. Okay, so when you're brushing your teeth, you're actually gonna wanna hold the toothbrush like this, not like this. You want very, very light hands on the toothbrush. You're gonna go 45 degrees, and you're just gonna gently brush, and you need to do it for 2 minutes. Use toothpaste and floss, of course, go to your dentist regularly, but that's how you're gonna brush your teeth. Most people are just scrubbing too hard and too aggressively. The other thing about a toothbrush is it needs to be a soft head, not a hard, bristly toothbrush. And if that toothbrush has been sitting in your drawer for like 2 or 3 or 4 years, it's got nasty bacteria on it, and the bristles are probably worn out. It needs to be soft. This one I can tell is a soft-headed toothbrush. This is a good one. The other thing is you can actually get a toothbrush too that has got a very, very small head on it for kids. Using a kid's toothbrush is actually better for you than this one. This one's got a very long head on it. A kid's toothbrush is about half the size, so it's better at getting in the back corners on your teeth in areas where this toothbrush actually isn't gonna do a very good deal. Now, if our teeth were like blocks, like you had like a block like this, or our teeth were like square-like, then this would be a really, really good toothbrush because it's really long and you can actually get a lot of efficiency with it. But it is very difficult to do that because your teeth are on an arch. So when you're coming around like the insides of your lower teeth, you kind of have to angle the toothbrush up like this. You can't go here. So if this toothbrush head actually was about this size, in my opinion, it'd actually be a lot easier to clean your teeth. Or if it had two little things, basically a long one here and a short one here, then you could just flip it around. That'd actually be a pretty cool invention. I should patent that. So that's just a little bit about brushing your teeth. So even though you're brushing your teeth, you can still have problems because you're probably not brushing your teeth the right way. So there you have it. Brushing your teeth alone won't help your teeth. It won't save your teeth. You can still have a tooth pulled. You can still have a root canal or need a cavity or a filling. You can still have major dental problems just because you brush your teeth. And sometimes people brush their teeth thinking it's gonna solve all their problems, but without this comprehensive approach, and that's the big key, it has to be comprehensive. There has to be regular checkups and flossing, oral health care, and we're kind of like your coach when you come in, your dental hygienist and your dentist. We're coaching you on how to get less cavities. Imagine a business model where you go in where they want you to spend less money and have less problems. That would be the dentist's office. So if you skip that, you're not doing the comprehensive part of the dental care. It's not just simply listening to an ad on TV and brushing your teeth thinking everything will be hunky-dory. It doesn't really work like that. It needs to be a comprehensive approach. And we as dentists, we're here to help you. Hygienists are there to help you. Everybody in our dental office, we've been over backwards to try to help patients and try to help you the best way that we can. But if you don't come and see us, we can't do that. And if you don't listen to our tips and actually take care of your teeth at home, your dental hygienist only cleans your teeth twice a year. So if you don't clean them at home, and the only time they get cleaned and flossed is at the hygienist, and so 2 times a year, your teeth get flossed. That is no bueno also. You don't want to do that. So it is a comprehensive approach, and it's just kind of a daily thing. Brush twice a day, but brush the right way. Use fluoride in your toothpaste and a soft-headed toothbrush. If you do these things the right way, I can promise you your teeth will be better, your teeth will be healthier, and you're gonna have less dental bills, and you're gonna like going to the dentist more. The dentist is actually gonna be a place that you enjoy going because you've done all the hard work. Now going to the dentist is their opportunity to take those x-rays and tell you you have no cavities. Congratulations. So I hope this information helps you, and as always, thank you for watching.